Dear students, in life diseases and prevention subject, today we are going to learn a new topic, osteoarthritis. Osteoarthritis is the most common form of arthritis affecting millions of people worldwide. In this presentation, we will discuss the major causative factors for osteoarthritis and the symptoms through which how can we come to know about the progression of osteoarthritis, risk factors identified for osteoarthritis, and finally we will discuss the lifestyle changes need to be incorporated in terms of the prevention of osteoarthritis and the available treatment procedures through chemotherapy and other activities. So in this flow, we will discuss this topic in detail. Okay. Osteoporosis occurs when the protective cartilage that cushions the ends of your bones wears down over time. Osteoarthritis can damage any joint. Most commonly, it affects joints in hands, knees, hips, and spine. Osteoarthritis symptoms can be managed and the damage to joints can be reversed. Staying active, maintaining a healthy weight, and some treatments might slow down the progression of the disease and help to improve pain and joint function. What are all the major symptoms for osteoarthritis? We'll discuss one by one. Number one is pain. The affected joints might hurt during or after a particular physical movement. Stiffness. Joint stiffness might be most noticeable upon awakening or after being inactive. Number 3, tenderness. The joint might feel tender when you apply light pressure to or near it. Number 4, loss of flexibility. Not be able to move your joint through its full range of motion. Number 5, grating sensation. Affected individuals could feel a grating sensation when you use the joint, and you might hear popping or crackling sound. Number 6, bone spurs. These extra bits of bone which feel like hard humps can form around the affected joint. The last symptom is swelling. The softened tissue inflammation around the joint may happen. So these are the major symptoms of osteoarthritis through which we can easily diagnose the individual with this problem. So in general, it includes pain, stiffness, tenderness, loss of flexibility, grating sensation, bone spurs, and swelling. What are the major causes of osteoarthritis? Osteoarthritis occurs when the cartilage that cushions the ends of bone in the joints gradually deteriorates, that is, decreases. Cartilage is a firm, slippery tissue that enables nearly frictionless joint motion. Eventually, if the cartilage wears down completely, bone will rub on bone. It causes changes in the bone and deterioration of the connective tissue that hold the joint together and attach muscle to bone. What are all the major risk factors that has been characterized for osteoporosis progression? Older age, the ultimate risk factor for both osteoporosis and osteoarthritis. The risk of osteoarthritis increases with age. Gender, like osteoarthritis and osteoporosis, women are more likely to develop osteoarthritis, though it isn't clear why. Obesity. Carrying extra body weight contributes to osteoarthritis in several ways, and more the weight, greater the risk. Increased weight adds stress to weight bearing joints such as your hips and knees. Also, fat tissue produces proteins that can cause harmful inflammation in and around your joints. Joint injuries. Injuries such as those that occur when playing sports or from an accident can increase the risk of osteoarthritis. Even injuries that occurred many years ago and seemingly healed can increase your risk of osteoarthritis. Repeated stress on the joint. If repeated stress on a joint continues, that joint might eventually develop osteoarthritis. The next important risk factor is genetical reasons. Some people inherit a tendency to develop osteoarthritis. Bone deformities. Some people are born with malformed joints or defective cartilaginous tissue. Certain metabolic diseases includes diabetes and a condition in which your body has too much iron, that is called hemochromatosis. These two conditions can also favor the acceleration of osteoarthritis in an individual. What are the major complications of osteoarthritis? Osteoarthritis is a degenerative disease that worsens over time, often resulting in chronic pain. Joint pain and stiffness can become severe enough to make daily tasks difficult. Depression and sleep disturbances can result from the pain and disability of osteoarthritis. What are all the methods available to diagnose osteoarthritis? There are few methods that have been characterized in terms of diagnosis. During the physical exam, your doctor will check your affected joint for tenderness, swelling, redness, and flexibility. Imaging tests. To get pictures of the affected joint, the doctor might recommend X-rays. The cartilages doesn't show up on X-ray images, but cartilage loss is revealed by a narrowing of the space between the bones in your joint. An X-ray can also show bone spurs around the joint. MRI imaging, that is magnetic resonance imaging. An MRI can produce detailed images of bone and soft tissues, including cartilage. An MRI isn't commonly needed to diagnose osteoarthritis but can help provide more information in complex cases. General laboratory tests. Analyzing the blood or joint fluid can help to confirm the diagnosis of osteoarthritis. Blood tests. Although there is no blood test for osteoarthritis, certain tests can help to rule out other causes of joint pain such as rheumatoid arthritis. Joint fluid analysis. Your doctor might use a needle to draw fluid from an affected joint. The fluid is then tested for inflammation and to determine whether your pain is caused by gout or an infection rather than osteoarthritis. What are the available methods for treatment of osteoarthritis? Osteoarthritis can't be reversed, but treatments can reduce pain and help to move better. Medications. Medications that can help relieve osteoarthritic symptoms, primarily pain, include acetaminophen. Acetaminophen, which is familiarly known as Tylenol, has been shown to help some people with osteoarthritis who have mild to moderate pain in the joints. Taking more than the recommended dose of acetaminophen can cause severe liver damage. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs taken at the recommended doses typically relieve the osteoarthritic pain in the joints, but their extreme doses will also result in severe side effects. These non-steroidal anti-inflammatory drugs can cause stomach upset, cardiovascular problems, bleeding problems, and liver and kidney damages. Non-steroidal anti-inflammatory drugs as gels applied to the skin over the affected joint have fewer side effects and may relieve pain just as well. Duloxetine, the drug which is also familiarly known as Cymbalta, normally used as an antidepressant. This medication is also approved to treat chronic pain, including osteoarthritic pain. What are all the other therapeutic choices available for the management of osteoarthritis? Physical therapy. A physical therapist can show your exercises to strengthen the muscles around your joints, increase your flexibility, and reduce pain. Regular gentle exercise that you do on your own, such as swimming or walking, can be equally effective. Occupational therapy. An occupational therapist can help you discover the ways to do everyday tasks without putting extra stress on your already painful joints. For instance, a toothbrush with a large grip could make you brushing your teeth easier if you have osteoarthritis in your hands. A bench in your shower could help relieve the pain of standing if you have knee arthritis. Knee comparisons. If conservative treatments don't help, you may want to consider procedures such as cortisone injections. Injections of cortisone steroid medications may relieve pain in your joint. During this procedure, your doctor numbs the area around your joint, then places a needle into the space within your joint and injects medication. The number of cortisone injections you can receive each year is generally limited to 3 or 4 injections because the medication can worsen joint damage over time. Lubrication injection. Injections of hyaluronic acid may offer pain relief by providing some cushioning in your knee. Though some research suggests these injections offer no more relief than a placebo. Hyaluronic acid is similar to a component normally found in your joint fluid. Realigning bones. If osteoarthritis has damaged one side of your knee more than the other, an osteotomy might be helpful. In a knee osteotomy, a surgeon cuts around the bone either above or below the knee and then removes or adds a wedge of bone. This shifts your body weight away from the out part of your knee. joint replacement. In joint replacement, that is arthroplasty surgeries, your surgeon removes your damaged joint surfaces and replaces them with plastic and metal parts. Surgical risk includes infection and blood clots. Artificial joints can wear out or come loose and may need to eventually be replaced after a specified time interval. So students, that's all about the informations of osteoarthritis. So in this presentation, we have discussed what is meant by osteoarthritis and what are all the major symptoms that can be used to identify osteoarthritis from other joint pains. And we discussed the major causative factors of osteoarthritis and the general risk factors characterized exclusively for osteoarthritis have been discussed, and we even discussed the complications arised due to osteoarthritic conditions, and we discussed the major diagnostic techniques available in modern days for osteoarthritis, that is imaging tester, lab testers are discussed. The general treatment options available for osteoarthritis have been discussed, which includes chemotherapy, physical therapy and occupational therapy. Some surgical procedures like knee comparisons have also been discussed. That includes cortisone injection, lubrication injection, realigning bones and joint replacement. So that's all about the information for osteoarthritis. So you please prepare according to this flow for your university examinations. I have already shared the notes of lesson for this particular topic with example pictures to understand more about osteoarthritis with a lot of clearance. So if you have any clarification, you just contact me. We'll discuss a new topic in the next class in detail. Thank you.